If you have ill parents, should they quarantine themselves from their children, or what? How do they actually handle that situation? And then, if two families actually are both isolated for 2 weeks or so, can they then safely come back together again and actually see each other and do things together?
Yeah, these are, and I'll say a few things, and certainly invite Erwin to say more from a clinical perspective as well. And it's one of these things that I think we're all getting a lot of questions because the social distancing policies paint with a broad brush, but then it's these nuances that we live our lives, right? The social distancing doesn't match our social structures, and we're seeing this a lot in some of the areas we work with multi-generational households. You have elderly parents with or grandparents with kids, and I think the reality is that if you're in a household with somebody who is otherwise particularly vulnerable to this disease, you have to treat yourself as if you're similarly vulnerable. What I mean by that is that, because you can bring that back into the household and transmit it to that person. Even if you're the one who's going out to get groceries, to take those extra precautions, to do those necessary things and to avoid any unnecessary contact, to introduce that into the household. In terms of the two families sort of connecting with each other, if we were in a world of perfect isolation, maybe, that would be the case. But every time we go out, every time you go to the store, do those essential things, there's a potential to be kind of re-exposed, reintroduced, and we worry about asymptomatic carriers. So I think it even if it is maybe theoretically at lower risk, it still wouldn't be advisable to start it's a slippery slope once we start, retreating on some of these social distancing measures.